Wellness for Life is brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership.
Hello, I'm Dr. Gothenburg, and I just want to bring you up to speed. This is really part two of, or an extension of our last program, and so I want to introduce Ernest Hutta. We're in Monaga today. This is someone who I've practiced with for 20 years, and I think what we want to do in this session, we're going to talk about some of the tools that we use together that are a little bit unique, and I guess the purpose of this, as we work together, is from my standpoint, I've utilized Ernest when I'm sometimes not satisfied or in a sense unhappy with the length of time, or why doesn't a person hold an adjustment? Right. And I've recognized a lot of times you have a lot of other tissue involved, muscles, tendons, ligaments, very, very hard to get to. So what we want to do today is to talk a little bit about how we work with instability, people that don't hold adjustments, and we want to talk a little bit about this microcurrent. I'll have Ernest expand on it, but simply put, this is a form of electrotherapy that really, its benefit is it stimulates blood flow. Correct. It has a calming or almost a sedating effect on the nerve system for pain. And I think another thing is it stimulates healing. So Ernest, why don't you tell us a little bit about how this is important to your practice and how we work this into ours.
Right. Well, I'll just draw the machine up as we talk and go through this, but the device that we're talking about is a machine that is called an Electro-Acu. Very, very powerful microcurrent tool based on the principle of biofeedback. The healing component that Dr. Gothenburg referred to is actually the fact that microcurrent therapies have been established to hyperstimulate the production of a chemical property in the human body called ATP, or it stands for adenosine triphosphate. So when you use microcurrent therapy, you're stimulating that effect in cell structures that help promote healing or the regeneration of damaged cells. And those damaged cells can be anything from injury, adhesions, scar tissue associated with surgery, nerve injury, you name it. There's no end to the spectrum of possibilities that microcurrent therapy can in fact impact. And as he talked about the calming components of it, very, very powerful when you're talking about starting with frequencies that are very, very low. And many, many, many patients have been to physical therapists and chiropractors and experienced the use of electromodalities. Could be interferential, Russian stim, ultrasound. You can go, the list is never ending of all the different devices and tools, and many of them extremely effective. But we have worked together now for over 20 years. He has them in his practice in Pelican. We have them here. And we've never found anything that works more effective in helping stimulate healing, calming nerves and injured cell structures. But to do that in complementing his work, again, ultimately comes down to what can you do to produce stability and make adjustments hold so that people aren't unstable. And of course, that comes into the marriage of Dr. Mark Wheaton as being part of our staff, because ultimately, if the instability is created by a ligament issue, which he addressed earlier in his conversation, we have to sometimes refer them out for prototherapy, which is a procedure done to stabilize or hyperstimulate the growth of connective tissue. That's ligaments, cartilage, and tendon. This device is intended to treat cell structures like muscles, nerve, skin, so on. So we can treat any number of things. Scar tissue and adhesions are extremely effectively treated with this device, but all of it, again, intended to marry to the work that he does to help create stability and ultimate healing and synergy and rejuvenation of people's health.
Another thing I'll add here too, we have other forms of electrotherapy in our clinic, and I can tell you one thing about electricity: it follows the path of least resistance. Yes. Therefore, some of the therapies we use, while the patient feels them, they may miss the target. Talk a little bit about what's unique about micro. It breaks those barriers, the Electro-Acu, and we can also treat meridians with this.
Correct, yes. It has the ability because, again, very, very passive and low frequency structure. It can help get past the point of resistance because it's not something you necessarily feel. In fact, we would like them to be able to relax and not have to feel irritated or feel contraction or irritation from the microcurrent. So our goal is to get it low enough that you're getting below the resistance components of cell structures. And then we work on using microcurrent therapy even with a Y probe that might be like this device. Sometimes we do it with a trigger point or acupoint tool. And our goal is to follow the pathway of these meridians throughout the entire human body, which the Chinese medicinal philosophies have developed over 3,000 to 4,000 years, maybe even longer than that, and proven that through acupuncture and other techniques that we obviously, we don't have an acupuncturist on staff, but we do reflexology, acupoint therapy with the electroacu Y-probe therapy, and then ultimately into really resistant cells, we just simply put on a set of pads and let the area treat and cycle over a 20-minute to half-hour time frame with heat to help break down the resistance of damaged cells.
Hey, I just want to say thank you. Again, I've been over in Managa today with Ernest Hutta. And you know what we really want to say is that if you think you've met a point in your health or your condition where you've leveled off and not showing any improvement, we think that working together we can bring almost a new level or do something to help rejuvenate your condition or improve your health. And so we're going to run a little trailer here that gives you information on how to reach either one of us. So thank you.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership,